Should your patient become or remain unresponsive, you should consider the use of airway adjuncts. The oropharyngeal airway, or OPA, supports airway patency in the unresponsive patient by preventing the tongue falling backwards and causing an obstruction. It is a simple plastic tube with a flange and bite block at one end and is available in 6 sizes covering the neonate to adult. Indications for use include any unresponsive patient with an associated loss of gag reflex. Contraindications include trismus, imminent danger of vomiting, or an intact gag reflex. Before insertion, the OPA must also be measured to ensure the correct size. The measurement is identical to that in suction and is described as the equivalent length as between the corner of the patient's mouth and the angle of the patient's jaw. Insertion technique is as follows. Invert the airway and insert into the mouth using the hard palate as a guide. Once insertion reaches as far as the soft palate, the OPA airway should be rotated through 180 degrees and should then be advanced until the flange sits at the level of the lips. On a safety note, insertion of an OPA is not definitive and offers no protection against gastric regurgitation. Should a patient vomit, the OPA should be removed immediately and further suctioning of the airway initiated. Using the airway mannequin provided, it is now your turn to measure and insert the OPA airway